So we've all heard about the importance of HIV and AIDS and how it affects millions of people all over the world. But what exactly is it? And what do we have in place to combat it? Human immunodeficiency virus is a retrovirus that, according to the World Health Organization, affected 36.7 million people globally at the end of 2016. Normally, HIV enters certain cells in the body that are part of the immune system. These cells are called CD4 cells or T cells. After HIV enters the CD4 cells, the virus begins to copy itself. To do so, it needs to copy its RNA, the virus's genetic makeup, into DNA. This process is called reverse transcription and requires an enzyme called reverse transcriptase. Okay, but how do we combat this? With antiretroviral NNRTIs. NNRTIs are one of 6 classes of antiretroviral drugs used to treat HIV. Antiretroviral drugs interfere with the ability of a virus to multiply or reproduce. To treat HIV, NNRTIs work by blocking the reverse transcriptase enzyme, preventing HIV from multiplying. NNRTIs inhibit reverse transcription by causing chain termination after they have been incorporated into viral DNA. For these drugs to be active, they need to be phosphorylated intracellularly. NNRTIs prevent the virus's reverse transcriptase from accurately copying its RNA into DNA. Without being able to make the complementary strand of DNA, HIV can't make copies of itself. Thus, the process of replication is stalled. So how do we know it works? What credibility is there behind this drug? So in 2011, there was a study completed in Colombia conducted by J. Galindo et al. It was a monocentric, non-randomized, open-label, 4-phase study to determine the effectiveness and safety on the usage of abacavir and lamivudine, which are both NRTIs, and efavirenz, an NNRTI, in the combination treatment of HIV-infected adult patients. The participants' median age was 37 years old, 72.7% are employed, and 63.6% were male. Data of the HIV RNA viral load and T-CD4 lymphocytes levels were recorded 3 times in the span of a 12-month period. The outcome of the trial resulted in 31 out of the 42 prescribed patients lowering their viral load of HIV-1 RNA suppression to less than 40 copies per millimetre, effectively meaning that the combination therapy accounted for a 73.8% viral suppression rate. Furthermore, the patient's CD4 T lymphocyte count had a median increase of 172 cells per cubic millimetre, showing the overall improvement of their immune systems. The antiretroviral drugs are relatively safe, although a small number of patients had shown adverse effects, such as skin rashes, dizziness, and drowsiness. Furthermore, there was one patient that was withdrawn from the study due to cardiovascular risk, with further research to be completed about further complications with cardiovascular diseases.
There are many drugs on the market that mostly consist of NNRTIs. Delaverdine is a NRTI and is a common drug used in treating individuals with HIV and AIDS. Similarly, zidovudine also does the job by mimicking thymidine, which is a nucleotide base that is incorporated into DNA when virus is replicating. Tricking the virus into thinking thymidine when incorporation causes DNA elongation termination. On the other hand, saquinavir is a protease inhibitor that targets protease viruses and rendering virus protease to become inactive. Specifically, the whole thing of protease breaking down human protein is a scheme. HIV protease is needed for breakdown of proteins, which is needed for virus replication. So by inhibition, virus can be stopped and growth is prevented. When undergoing HIV/AIDS treatment, individuals may be impacted socially. These impacts could include social stigma, as individuals may be exposed to discrimination, lowered self-esteem, and poor mental health, which ultimately leads to a negative quality of life. Medication treatment for HIV/AIDS can be very expensive, especially for those without government funds or support. There are also clinical impacts such as medical complications. Drugs are sometimes combined with others to increase their strength. However, this can sometimes lead to side effects that some individuals may experience due to drug allergy. Drugs resistance is also a major impact when individuals undergo long-term treatment, which could lead to virus building resistance against specific drugs.